Hello, good evening. Am I audible?
Okay, ma. Yes, ma. Yes, ma. I can hear you
All right.
clearly.
So sorry for all of the delays and the network issues, but I think we just dive right into it. Introduction to Specialties in Nursing, right? Um, I think that book that was written by forgotten her name, but you're hearing me. That's Taiwo. Can you hear me? You can hear me. Okay, thank you. So saying that
Yes, all right.
today's introduction to nursing
Yeah, I can hear
specialties,
you clearly.
and it's no news that nursing is vast, but in Nigeria,
Yes.
I think in Africa, but majorly in Nigeria, there's a limitation of the scope of practice. There's a limitation to the knowledge we have of the capacities we can operate in as nursing professionals and as nurses basically. So I have here with me some generic, I think, okay, we're just four here. I thought we have a bigger number, probably because of the login logout stuff. But for those that are with us, can you just type in the chat a few of the specialties you know that are prominent in Nigeria? Just type it, type it, type it, type it there. Let me see that. I have people with us. So just mention some special one. We have midwifery, we have renal nursing, we have ophthalmic nursing, we have public health, psychiatric nursing, yes, learning disability nursing, we have accident and emergency nursing, that's A&E or ER nursing. We have surgical nursing, peri-op. We have what's it called, critical care nursing, that's CCU. We have ICU care nursing. We have occupational health therapy nursing. We have renal nursing. We have dental nursing, we have pediatric nursing. Pediatric nursing is really vast because if you break down pediatric nursing, that's where you have the neonatal nurses. They work in NICU. NICU stands for Neonatal Intensive Care Unit. We have PICU, Pediatric Intensive Care Unit. That's for older children. Then you have under pediatrics as well, you have endocrinology nurses for all those children that come up or are born with congenital endocrine issues, things like cretinism and Down syndrome and things like that. We have genetic nursing as well. These are nurses that specialize in any genetic disability that could happen in children and or that could develop in older adults as well. We have military nursing, we have nurse educators, we have orthopedic nurses, we have school nursing, right? So there are lots of that, but I think the ones I mentioned, this about how many that I mentioned, maybe 15 or 20 that I mentioned, are the most common ones we have in Nigeria. So I'm going to go over it again. We have midwifery, we have occupational health nursing, we have anesthesia nursing, ophthalmic nursing, renal nursing, dental nursing, critical care nursing, that's CCU, intensive care nursing. We have psychiatric nursing, we have perioperative nursing, we have pediatric nursing that can be broken further down into neonatal pediatric, older pediatrics, and endocrinology nursing. We have nurse educators, military nursing, orthopedic nursing, school nursing. Right. Now, what are the advantages of specializing? Because I see some people, I work with a lot of general nurses here in my facility, and there's this beef that general nurses have when they see you're on duty, there's no surgery, I just chopping AC, sometimes you won't leave the hospital, you come back, they'll be like, are you on duty? Yes. They'll be like, ha. When me, I'm battling with like 5, 6, 7 patients, that's your cup of beans because you didn't specialize, right? And I'm talking about the benefits now, the advantages, right? Don't mind me. I'll still go to the other side of even if you don't specialize, there are career pathways that you can take as long as that's what you're passionate about and that's what your interest wants, right? So what are the advantages of specializing? Number one, it gives you some sort of a level of autonomy, right? When you're a specialist, nobody is coming to teach you your job. Nobody is coming to give you orders. Nobody is coming to double check your work and say, this thing, are you sure you can do this? You are trained. You went for additional training. You are certified. You have the certificate to show that, oh yeah, I'm a certified surgical nurse, I'm a certified perioperative nurse, you understand? I'm a certified theater manager. So I am in charge of this theater. It's not you, not be you go, they tell me where I won't go. Let me just use that pigeon. so to say. So it gives you, specializing gives you a level of autonomy of practice, pathway in nursing, that unique voice. The more you are able to stand on your own, the team of the matter thing, understand. So specializing gives you autonomy, a level of autonomy. Two, it creates more opportunities for career growth. Right? If you're a general nurse and let's say they are looking for someone to fill a position of a intensive care nurse, a nurse intensivist, that's what they call them. They're looking for a nurse intensivist in a new hospital, groundbreaking research center, and they want a nurse intensivist. Let's say, even if you don't have any experience, you just want somebody who is certified as a nurse intensivist to apply. But you're a general nurse, you can't apply. You're not eligible, right? You're not eligible for that. So it limits the amount of career opportunities that you can jump on, that you can apply for, that you can dive into. You are limited in some sort of way. Just like if a doctor goes to school, he finishes his 6 years, he does his housemanship, and then he just practices as a medical officer. He worked 7 years as a medical officer. He is not a senior resident, he's not a junior resident, he's not in pediatrics, he's a specialist. So if they want to do any case that has to do with a peculiar kind of disease, they will look for someone who is a specialist in that field. Does it make him any less of a doctor? No, he's a doctor. Maybe a very good one, but he's not a specialist. The same thing applies for nurses. So the first thing specializing in is that it gives you a level of autonomy. It also creates more opportunities for career development. And thirdly, financial access to finance. Yes. When I share my story of why I chose perioperative nursing, people always want to look at, oh, because they pay periop nurses well. Money was the last thing I considered, but I considered it. It was the last thing I considered, but I considered it all the same. There were so many other reasons why I wanted to do perioperative nursing. But at the same time, if you don't have a person that is feeding your passion, you will go hungry, even passion will die, you understand? So when you specialize, there's a level of respect that is accorded to, okay, this person has gone through general nursing for so number of years, and this is what we pay these people. This person has now gone further to specialize in this and this. Of course, we're not the same level, so we can't be paid the same thing. What you pay a specialist is different from what you pay a general practitioner in any field, you understand. So, of course, access to more financial funds. And then it gives rooms for self-development. I can say that ever since I got into practicing as a perioperative nurse, it has exposed me, because as a theater manager, no matter how young you are, even if you finish periop today, you are in charge of that theater. If anything goes wrong, anybody breaks protocol, breaks sterility, does anything that is not supposed to do, it is not that person. They will tell you who is the periop on duty, who is in charge, because they have taught you how to manage both the people, the surgeons, the surgical team, and then the resources that you have, the machines you have, the instruments, the consumables. So you must be able to harness the leadership strength from somewhere to be able to take care of all these things at the same time. So it helps you to develop. When you rise in your career, there is a call on you, a call for more critical thinking, a call for more effective communication, a call for leadership, all those things, because it's not just the title as well. It's the kind of person you become as you grow. Then lastly, it allows you to contribute meaningfully to patient care. Let's say I was just a registered nurse, still working in Evercare here, and then there's a patient that just came out of surgery. Let's say he had exploratory laparotomy done, or even CS, cesarean section, right? And she's on the ward. Okay, I'm a periop nurse, and then there's a friend of mine that's a general nurse. And then I realized that this woman that had cesarean section done is not on anti-embolism stockings. Someone who just had surgery, cannot get up and ambulate and walk all around and allow for effective blood circulation. But if the person is on the bed, there is a risk for that person to throw an embolus. If you throw an embolus, you can get into cardiac arrest, pulmonary distress, and all of those things. Most registered nurses, all they know is, baby is out, mother is fine, you are not bleeding, you are okay, vitals are okay. But because I know the background of the kind of surgery she did, the implications of staying on the bed, I know that this and this and this and this must be done. So when I come into a space like that, my contribution to that patient's care is meaningful, is specific, is tangible, is palpable. Anybody that hears me say, oh, this patient has to be on this stockings, this and this and this are the reasons why, because after surgery, this can happen, this can happen. Everybody, oh, are you the period nurse? Yes. My specialization, the knowledge I gained from specializing allows me to contribute meaningfully to patient care and to patient outcome. So the advantages are endless, really. So I'm going to encourage anybody who will watch it, if there's going to be a replay of this probably, or who is live here with us. It's fulfilling to specialize both in Nigeria and abroad. Now, the limiting factor for us in Nigeria is that we have a limited scope of practice, even with those specializations. You cannot, let me think of one of the specialties, say radiology nursing now. We don't have a lot of nurse radiologists. We only have doctors that, oh, the doctor and the radiologist. There's a limit to the scope of practice we have for specialties in Nigeria. So I remember when I first took a liking to peri-op, at first I loved psychiatric nursing, mental health. And I was so sure that, no, after nursing like this, I'm going to Arrow. First, next bus stop, Arrow. It was when we came back that we did data posting. And when I got to data post, I knew that no, Arrow is not it. Arrow is not it at all. My personality, my passion, my desires, and then some little factors like AC, because I don't like heat. I don't like heat at all. So I thought that the working environment is something that is very comely to me as a person. I say no, this has to be it. It was later on I now thought to ask her, wait, how much are they paying people that are staying inside this AC? You understand? So back to what I was saying. Let's say travel nursing now. So we don't have a lot of that in Nigeria. Oncology nursing. Mostly is doctors, oncologists, doctors that specialize as oncologists that take care of patients. And you just see if you are a nurse working with cancer patients, you need in-depth knowledge on the progress of that type of cancer. You need in-depth knowledge on the type of chemotherapy session and drugs that are being used. You need in-depth knowledge on pain management, the chronic, not just normal pain management now, chronic pain management, how to assess that pain, how to manage that pain, and in the process of managing that pain, still give this person a level of life that they can still live. If you put me in that position now, they say, okay, today, Sarah, I'm going to be working in the oncology department. I don't know the first thing to do because there's a specialty for that, but the scope of practice in Nigeria is limited. Now, when I see young nurses, the one of the that come to me and say, oh, Nurse Kumi, I love what you are doing. I want you to mentor me. One of the first questions I ask them is, what's your plan, short term and long term? What exactly is your plan? What do you want to do? And they're like, next thing I want to do is I want to travel out. To do what? Is it just for the money? Do you have a career plan? Do you have something you are interested in, you are passionate about? Have you done your research? It's not just going to UK, going to UK, going to UK. Sometimes for the kind of specialty you want, it may be in Netherlands, it may be in Scotland, it may be in Australia. You understand? And there are opportunities to travel for education, for scholarships, for work, things like that. So you need to do your research very well to know, okay, if it is if I want to become a certified clinical nurse researcher, because there's a specialty like that, that nurse is basically a researcher, clinical researcher. So anything about clinical practice. She's researching in that area. You understand? She's not going into administration or education. No, that's not her field. She's a clinical nurse researcher. If it is, let's say, insurance or forensic nursing, specialty in nursing that deals with patients or people who have been exposed to of violence, either workplace violence, any kind of abuse. Basically, forensic nurses, that's their specialty. They merge a little bit of law with a little bit of healthcare, right, to be able to help patients. Then there's legal nurse consultant. You can become a legal nurse consultant or a nurse attorney. That means you don't have to have a law degree for that. There's a course, although you have to have a master's. So some of these specialties, most of them, that the scope of practice are not in Nigeria. You have to have a master's in nursing, an MSN, for you to further progress, or you have to further to go and do a bachelor's in that course before you can practice. And we don't have most of those that scope of practice here in Nigeria. So what was I saying? So it's important that you do your research very accurately before you choose a specialty. Do not choose a specialty because your mentor is there. Do not choose a specialty because of the amount of money you are going to make. Money is not everything. I have colleagues, I have people who are period nurses who are still looking for something else they can do that they will enjoy because they came into period for the money. And every specialty, let me just put this out there, as much as I've mentioned the advantages, right, of specializing, the advantages are there, but the challenges also come. Each specialty has its own challenges. The challenges on your health, your physical health, your psychological health, your time, really, right? So do your research, talk to people. I remember I spoke to no less than 7 or 8 people that I know were already practicing in different areas of nursing. And I spoke to them. I said, "What do you do? Okay, you do this. You're a dental nurse. Okay, how is that like for you? Do you enjoy what you do?" And it was the last person I spoke to who was a perioperative nurse that spoke so passionately beyond the work. You know that this person is fulfilled, this person is happy, this person stands. So I made sure, aside from praying and knowing the will of God for my life and knowing what direction God wanted me to take, I made sure that is this something I'll be happy waking up to do every morning. Somebody asked me one day, I was going to work in the morning, and I was basically jumping and just nobody asked me what you're in it, and it was like it's like you like what you do, Abby. You like, and this person works in asset management in the bank, in one of the banks in Lagos, and he studied accounting. And so I engaged him in a conversation. I said, "But you are basically working in an area of what you study. Are you not happy?" He said, "I just studied accounting because some people were studying it, and it seemed like a good decision at that time." Don't ever let that be you. Don't let anybody pressure you into something that you know long term will not find fulfillment in. I think at this point in time, we're going to take questions. But before then, I just want to mention a few other specialties that are thriving outside the country. They don't have that scope of practice in Nigeria yet. So we have insurance nursing. There's someone I know in Nigeria though that is entering that field, that's really gaining ground in that field. If you can maybe just look him up or research more about him. His name is Adebo Alefalumi. He's an insurance nurse. So you can look for Mr. Adebo Alefalumi. He's a nurse. Then one moment. CCU nursing and ICU nursing. There's a school for that somewhere in Abuja. Yeah, okay. So for CCU nursing and ICU nursing, there's a school for that somewhere in Abuja. That's critical care nursing and intensive care nursing. So we have schools like that in Abuja where you can train. Anesthesia nursing, there's one in Enugu. I think there's also, I don't know, I'm only sure of the one in Enugu. Then we have gerontology nursing or geriatric nursing. Just like we have pediatric nursing, we have geriatric nursing. We have fitness and personal training. So there are nurses that are fitness trainers. Now, if you have a very good understanding of the human body, human anatomy, the muscles, muscular system, physiology, and all of that, you can specialize in training people. Athletes, most of these athletes, footballers, wrestlers, anything sports really, you can become a personal trainer to that. Imagine being a personal fitness trainer to Ronaldinho, a football player. You can tell him, oh, the way you play, I think you benefit from this and this type of exercise. The way you play, I think that this type of stretches will work for you. The way you play, I think this type of food you can eat it more consistently. You can help them in their diet. Then there's also what's it called? There's a name for them. It's not nutrition nurses, dietetic nurses. They're dietetic. I know they are dietitians, but there's a branch of nursing that deals with diet. So you can work in a hospital and head a dietetics and nutrition department whereby you are overseeing the meal that each patient that is probably diagnosed with chronic diseases, let's say hypertensive patients, CKD patients, patients with chronic kidney failure, heart issues, you are overseeing their meals and knowing that, oh, for this condition. And it's not just about the food. You get into the ward, you look at their laboratory results, and you see that, oh, this person's potassium is high. Okay, so it means he needs a food that is low in potassium. You definitely not give that person plantain to eat. You understand? So you're clinically in touch, and then you're also doing what you love. Then there's pain management nursing, there's travel nursing, there's infection control nursing. Infection control is a rising necessity that is coming up in Nigeria, especially in private care settings. I'm not sure about government hospitals, but most of the private care institutions that I have been to and I have worked closely with, they are really keen interest in infection control. These are people that do research and they come back to give you evidence. Your theater. This is the type of barbating here. This room, because they are wearing this type of shoes, that's why your patients are coming down with this type of wound diseases, this and this. So they do research on your facility and they give hard evidence and say, do this, modify to wearing this type of clothes, don't wear this type of shoes. You understand? So infection control nurses, then there's legal nursing, there's home care nursing. You know all this home care that we'll go and do for 2 weeks, 2 weeks on, 2 weeks off, things like that, right? So there's that, there's home care nursing, there is family nurse practitioner, there is health informatics. Health informatics. This is another area of nursing that's thriving in of the telehealth, the telehealth nursing as well. So health informatics and telehealth nursing are almost going hand in hand because each of them have to do with data and data analysis. So you may have to take maybe a short course in computer science or something like that. I have a very close friend of mine that is currently practicing in the UK as a nurse. And she realizes that she has affinity, she's passionate about anything that has to do with computing data, analyzing data, collecting the data to give this result, and you have, things like that. And she has started her degree in computer science. She's in the UK, she's practicing as a nurse, but she has started her degree in computer science because she wants to delve more into health informatics later in her career. So the opportunities are there. Don't just relocate for relocating sake. Don't just jackpot. Why? Where the place you are jackpot into, does it have the opportunity for you to go to that place that you are looking for? Have you done your research that, oh, this hospital, okay, the place I'm going is closer to Johns Hopkins. Does Hopkins Hospital offers training in health informatics, things like that? Plan yourself, arrange yourself. Don't let anybody rush you anywhere. You understand? So the land is green. The field of nursing is green. It is vast. It is wide. The opportunities are endless. You understand? So I think I'm just going to drop the ball at this point and just entertain questions.
Thank you so much, Ma. Thank you so much. Really appreciate. Thank you so much. I believe you can hear me, Ma. Thank you so much, Ma. Thank you so much. Like I've learned a lot personally. And please, if you have questions, kindly drop your questions so that we can do that. I believe you can hear me.
Thank you. So I've seen that question. Simply Omoyemi is asking, what can you say about a nurse who is passionate about being a midwife, family planner, but being told not to do it
Are you
because
there,
she
Ma?
feels
Can
it's
you hear
not a
me?
money-making work? If there's one thing I've learned over time is that you need to weigh the advice of others. When I wanted to leave a government establishment that I was working for the private hospital I'm working now, everybody said, no, there's no job security. What if they wake up tomorrow and sack you? I know this person that they sack. And they'll just bring up one in a million excuses for you not to do what they never had the courage to do. So if you are passionate about it, you have a plan, you've researched into what and what you want to do. Because you and want to do the same everybody is doing at the same place, maybe one PAC center somewhere, you understand, and expect to make a change. Do you have a plan? What's your plan? Have you thought it through? Have you prayed? Yeah, what's it? Have you prayed about it? If you have a plan, you have God's backing, you are passionate about it enough, and you know that this is what you want to do, and no matter the challenges you face, you will see it through. It may not be only Nigeria. You will start an organization from this, right? Where you train women and you teach women and you go from center to center. In UNICEF, WHO, Mastercard Foundation, there are many organizations that are into maternal and child health care. You understand? So they're looking for people who are really passionate about their work. The money will come later. The money will come through grants, through fellowships, applications, scholarships, things like that. There are endless opportunities in that space. So if you are really passionate about this, I advise that you go for it. Go for it. So second question, please, do you have any info on how to become a clinical nurse informatics specialist? Some say a master's degree in health informatics after a bachelor's in medicine. What is your thoughts, Ma? So for different countries, there are different what's it called, procedures, right? But what this is most likely true, you have to do a master's in health informatics, or you do a postgraduate diploma in it. You look for universities that do that. But I have someone who is a nurse informatics. I can ask her and then probably give you feedback. So send me a message on Instagram telling me, oh, this is your name, this is the question you asked, and this is the feedback you're expecting.
Thank you so much, Ma. Yes, Ma. There is a question here. I don't know whether I see there, Ma.
Yeah, I'm with you. So what are the steps to follow to become? Okay, I'm actually really in a rush to go somewhere. So can I send you voice notes of these questions? Everybody can ask their questions, and then I send you voice notes of the answers, and you can.
Thank you so much for waiting for your patience, for trying to, despite the technical issues, we still have people around. So we'll continue next time. So it will be communicated to us, and definitely we are going to fix every issue, every technical issue now, and it will be much more better next time. So this is our first one. So we are just starting off. I pray I know that you are helped by God. Thank you so much for for listening. And if you have any question again, kindly drop it to NurseEmerge. We are going to attend to everything. Then stay tuned because there is a lot of things coming from NurseEmerge. A lot of things coming from NurseEmerge. We are going to be picking different specialties one after the other. We talk more on it, discuss more on it, how to get there, their pay and everything. You know much about the specialty you want to go for. Thank you so much. Goodbye. Thank you so much.